Hello, my name is Dr. Behnam. I'm a board-certified dermatologist, laser and skin cancer specialist practicing in the beautiful Santa Monica, California. Welcome to our educational videos, this one entitled Zoster, also known as shingles. So, shingles is caused by a virus known as the Varicella Zoster virus. It's actually the same virus that causes chickenpox. Later in life basically causes shingles. The virus lives within the nerves and then it basically becomes active years down the line. For the most part, patients over 65-year-olds are susceptible to getting and developing shingles. The classic area of shingles, it's typically on the chest or on the back, is what we call in a certain specific section that it displays itself, known as a dermatome. Dermatome is a section of an area where a specific nerve resides. The signs are typical tingling, burning sensation that starts kind of in the back and starts progressing basically towards the front. In a couple of days, blisters begin, and those blisters basically crust over. By this time, the areas have become tender, painful, sometimes throbbing, as well as even itching at times. It is very important to start medications and therapy within the first 48 to 72 hours. During the entire process of shingles, the patient is contagious, so I highly recommend that they stay away from pregnant patients as well as infants. When a patient with shingles comes to the office, typically the clinical distribution of having these crusting as well as blistering basically from one side of the chest to the back is a classic pattern for this. In those instances, I typically give the patient some topical steroids as well as put them on an oral antiviral medication, be it acyclovir or Valtrex. The patients typically take it for 1 week, and I've seen it back in 1 week. They're going to be a lot better. One of the biggest problems of shingles is that it could cause what we call post-herpetic neuralgia, which means pain and tenderness at the start of shingles. This is why we treat patients very aggressively. Years ago, there was an article in the New England Journal of Medicine that recommended shingle patients to be treated with pain medication known as Neurontin. So in our clinic, when patients come in, we treat them with oral antiviral medications as well as Neurontin simultaneously. There are cases where shingles appears on the face, and in fact it could sometimes affect the same nerves as it does the nerves of the eyes. In those cases, it is very important that you see a dermatologist right away, you're placed on the appropriate medications and even sometimes prednisone to reduce the inflammation, and also see an ophthalmologist and be followed by ophthalmologists. Early catching of shingles on the face is very, very, very important, and I cannot overemphasize this. For the most part, in general, shingles does go away. It is really the post-herpetic pain, the post-shingle pain that could be left behind. Again, this is Dr. Behnam from Dermatology and Hair Restoration Specialist. Please visit our website, santamonicaskin.com, for other educational videos. Have a nice day.